Yeah, hi, I'm Richard Wender. I'm the Chief Cancer Control Officer at the American Cancer Society here in Georgia. There are several factors that contribute to risk for colon cancer. Clearly, a family history of colon cancer increases risk, and there are a couple of specific genetic syndromes, familial adenomatous polyposis or hereditary non-polyposis colon cancer syndrome, which dramatically increase risk. People with Crohn's disease or ulcerative colitis are at very high risk. But there are additional risk factors like smoking. We now know that a high intake of red or processed meat contributes to risk. But at the end of the day, a substantial number of people, probably as many as 80% of colon cancer cases, occur in people without a family history and with no obvious known risk profile. One of the most important risk factors for the development of colon cancer, perhaps the most important, is aging. The colon cancer goes up with each year of advancing age till people are well into their 60s. And the vast majority of colon cancers occur in people over the age of 50. And that's why screening recommendations begin at 50. So age is a critical risk factor and a major determinant of risk.
My name is Dr. Janava Joseph, and I am the medical director at CDC's Colorectal Cancer Control Program, which funds actually 31 grantees to implement evidence-based interventions and partnerships with healthcare systems to increase colorectal cancer screening. You know, it's a preventable disease, unlike some other cancers where early detection is really your only option. This is a cancer where you actually have the option to find precursors or polyps before they even turn into cancer. So you can really have an opportunity to prevent people from getting cancer in the first place. So the good news is the incidence and mortality from colorectal cancer have really been declining, especially over the last 10 to 15 years, which is great. The not so great news is that it hasn't affected all populations equally. So some have benefited more than others. So African Americans in particular have a much higher incidence and mortality rate from colorectal cancer. Although their rates have also gone down over time, they still far exceed other racial and ethnic groups.
The trends for colon cancer are very interesting because we're seeing great progress in both incidence and mortality reductions for people 50 and older, the ages for which screening is recommended. And a lot of this progress is clearly due to an increase in colon cancer screening, the removal of polyps, the early detection of colon cancers. But unfortunately, we're seeing exactly the opposite trend for people younger than age 50, where the incidence of colon cancer is going up by about 1.7% per year in people under age 50. We don't fully understand why this is occurring. It's not just in people with positive family histories. It's not just in people who are overweight or obese or have any other obvious risk. So it's an area of great intense interest right now, why this risk is going up in younger people.